WFYI podcast brought to you by Bloomington, Indiana, an American college town offering food and drink, college sports, outdoor activities, live music, cool art, and good times daily. Everyone is welcome in Bloomington. More information at visitbloomington.com.
This is WFYI News Now. It's April 2nd, and I'm Abriana Herron. On today's show, a new study of the health impacts of pollution, a highway that charges electric vehicles, and many are committed to increasing healthy, affordable food access in Indianapolis. Yet an estimated 200,000 residents are still in need.
It's proven very hard to incentivize full-service grocery stores to move into these neighborhoods that have been so disinvested in.
Those stories coming up, but first, Indiana did not make any changes to the vote-by-mail process this past legislative session, but it is still inaccessible to many Hoosiers. Indiana Public Broadcasting's Violet Cumber-Weiland reports one advocate is working to remind voters of the requirements needed to vote by mail.
To vote by mail, Hoosiers must meet one of 11 different criteria, such as being 65 or older or being confined to your home. Barbara Tully is on the state board of the League of Women Voters. She says the process to register to vote by mail is easiest on the website indianavoters.in.gov.
You have to check one of those reasons, and then you need to provide either your driver's license number or the last four of your social security number. And if you don't have one of those, then you have to call the clerk's office and get your voter ID number and put it on that application.
Tully says the vote by mail process in the state is not accessible to many Hoosiers, which can lower voter turnout. She says she hopes to see increased opportunities to vote by mail throughout the state in the future. For Indiana Public Broadcasting, I'm Violet Cumber-Weiland.
The deadline to register to vote either in person, online, or by mail is April 8th. A new study found that 50,000 premature deaths and over 100,000 new cases of pediatric asthma were due to pollution in 2019. As Side Effects Public Media's Elizabeth Gabriel reports, pollution in Indiana caused about 1,600 premature deaths and over 2,000 new cases of pediatric asthma.
Air pollution in the United States has decreased over the past few decades, but the racial and ethnic disparities in air pollution levels have widened, a new study found. Gage Kerr is a researcher at George Washington University and the study's lead author. He says these disparities impact areas that already have health struggles.
So even without air pollution, they're sicker because they have, reduced access to nutritious food or healthcare, etc.
According to the study, the racial and ethnic disparities between the least and most white communities has widened by 16% for premature deaths related to soot and 19% for pediatric asthma related to nitrogen dioxide. Elizabeth Gabriel, Side Effects Public Media.
Purdue University and the Indiana Department of Transportation will start construction this week on a segment of highway that can charge electric semi-trucks as they drive over it. As WFYI's Ben Thorpe reports, researchers say the one-of-a-kind project could transform highways across the country.
Work will begin on a quarter-mile segment of roadway just outside of West Lafayette that will allow batteries for electric semi-trucks to charge as they pass over them. Purdue Research Assistant Professor Aaron Brovant says the system would be strong enough to charge electric cars and maintain the battery charge of heavy-duty electric vehicles, so they would never need to stop and recharge.
You could get anywhere in the country, really, without having to stop from point A to point B, except as you desire to. Because as long as you're on that interstate system, you have infinite range.
Brovant says if the system is implemented in highways across the country, it could solve both range anxiety concerns around electric vehicles and reduce emissions. Researchers hope the quarter-mile strip of roadway can begin testing sometime next year. I'm Ben Thorpe.
And for our final story today, Equitable Food Access, a movement in Indianapolis, seeks to get healthy, affordable food to people who need it, but an estimated 200,000 residents are still in need. WFYI's policy editor Jill Sheridan has covered the issue for years, so our reporter Ben Thorpe sat down with her to talk about the different players in the movement, why the problem persists, and what she's watching for in 2024.
Indianapolis has dealt with the problem of so-called food deserts for years. What does this mean today, and what work has this city done?
Food deserts are areas where residents have no convenient options for affordable, healthy food. Now, while the term food desert has shifted a bit, I think people still understand the core issue of equitable food access and how that disproportionately impacts some neighborhoods more than others, and that connection between healthy food access and health disparities. Now, I spoke with David Hampton, who's executive director of LISC, which is a nonprofit that works on the roots of inequity in our city, and LISC partnered with the city and others on an equitable food access initiative, and this is what he had to say.
Food apartheid, supermarket redlining, these are historical injustices that have persisted, and every effort is designed to sort of offset some of the long-lasting effects that are pervasive that really create the food insecurity.
So maybe talk to us a little bit about the Indianapolis neighborhoods that are most impacted by that lack of access to healthy food.
Well, it's the same neighborhoods that struggle with other disinvestment issues. So we're talking financial deserts, a lack of green space in some neighborhoods, safe infrastructure, neighborhoods like the Far East Side, the near Northeast Side. And to couple this issue, there were a number of full-service grocery stores that closed in the mid-2010s in Indianapolis. There was the Double 8 stores in 2015, and then 2 years later, Marsh closed all of its stores. And some of those stores had served these underserved communities for decades. So it's proven very hard to incentivize full-service grocery stores to move into these neighborhoods that have been so disinvested in.
What has the city done to close some of those neighborhood gaps and help people connect with affordable food?
Well, when the pandemic hit in 2020, the city decided to restructure its food policy efforts under the Office of Public Health and Safety. The Division of Community Nutrition and Food Policy started out with a staff of 2. Now, there's more than a dozen on Director Malele Kennedy's team. And here's Kennedy when I visited with her in the City County building a few months ago. She explained how the changes have informed recent moves.
That really, in 2020, shifted our thinking around what was needed in the food system. We realized right off that there were some pretty significant gaps in services and how we reached residents.
So what they did is target specific zip codes that lacked access and included many of those same neighborhoods. And they found that transportation was an issue. So they implemented a Lyft partnership where residents can get dollar rides to the grocery store. They also identified local corner stores that could scale up to become more full-service grocers in neighborhoods and offer things like SNAP. They also invested in urban agriculture programs and partnered with more than 40 local growers. Here's Kennedy again.
It's really about understanding what the neighborhood needs, what residents need, what kind of food they want, thinking about that culturally relevant food, but also how do they want to receive it.
Okay, Jill, so I think this is the big question here. Has it made an impact? Have there been new grocery stores opening up in Indianapolis?
Well, there have been new stores built, but the majority are not in areas that need them. Although one grocery store that opened last year stands out. Indy Fresh Market is a Black-owned local market in a near Northeast Side neighborhood that was a food desert. Michael McFarland and Marcus Williams saw this need and partnered initially to open a convenience store. In 2021, they connected with the city, Cook Medical, and community development groups through an initiative led by Cook to improve quality of life in the community through this development investment. Their new $2.5 million full-service grocery store opened last year, and it sits right on 38th Street where Indigo's Purple Line is being built. Marcus talked to me about his experience and how he felt other partnerships, individuals, and neighborhoods needed to put their heads together to find permanent local solutions.
You have to step up. You have to be courageous for your community. I wish a lot of other people would think like this, make the city a better place. You know what I mean? We can help out as much as we can. And just try to make the city a better place to live,
So what I'm kind of hearing is there's probably a lot of work still left to do. Maybe you can talk about what efforts are you going to be watching in 2024?
So I will be interested to see how urban farming programs do grow in the city. And also if we're able to incentivize more grocery stores through these partnerships to open up in neighborhoods that really need them.
That's all for today's episode of WFYI News Now. Our podcast is produced by the following people who live in your community: Drew Dodlin, Kendall Antron, who composed the music for this podcast, and me, Aubriana Herron. Our news director is Sarah Neal Estes. If you like today's episode, remember to subscribe and share. And follow WFYI on Instagram, Facebook, and YouTube to check in on our newsroom throughout the day. Thanks for listening. We'll be back tomorrow.